To kick off the day, allow me to welcome our keynote speaker, Desi McCue. Desi is a seasoned healthcare executive with extensive experience in operational leadership across patient access, scheduling, imaging, and nursing. She holds an MSN, an MBA, and a doctorate, is a fellow of the American College of Healthcare Executives, and is highly trained in healthcare finance, leadership, and human-centered practices. Put your hands together for Desi.
All right, you guys can hear me right here? Yeah? Okay, great. Just wanted to make sure. Welcome. Thank you for being here. I'm super excited and honored to be with you. I have been a partner with HFMA for a while, ever since one of the CFOs I worked with said, hey, you should consider joining this organization, which I had never heard of before, actually. And one of the reasons she asked me to join or suggested it was that she said, we are all the CEOs of whatever area we're in, right? So if I am the manager of a department, I'm the CFO of that department. Their financial outcomes, their organizational outcomes and strategies are all up to me, right? I'm responsible for what my team does there. Same if you're a director, and same if you're a frontline contributor. If you're at the front lines and your work requires something that touches finances for the patient, the hospital, for the system, you're doing something in which you're playing a smaller CFO role, but still a CFO role. So I've always kept that in mind. I've been very engaged in HFMA, got my nurse executive finance certificate this last year, which I'm very proud of. And I'm hoping that what I share today will resonate with you in whatever role you have today or the one that you want in the future. So we'll go ahead and get started. Hoping my slides change. This is always where you don't know. Hashtag technology. I might need the clicker. Or a mouse. Uh-oh. She fails on the first day. All right. Learning objectives, you guys could read about them. They were in your program. I am just also a doctoral prepared person, and so I feel like I have to put these things up there. Okay. So let's talk about this quote by Christine Sinsky. Dr. Sinsky is a physician and a healthcare researcher. And she is one of the passionate speakers about the quadruple aim in healthcare. So the quadruple part of that aim being not only do we have to be financially whole and deliver great patient outcomes, but we also have to take care of the people who take care of the people. And that is one of the most important parts of me doing my job effectively, is taking care of the people who take care of the people. So if I'm treating someone really poorly, do you think they show up to work and do their best work? Probably not, right? Most people come to work wanting to do the right thing, but when they're hindered by that, by other people in their sphere, that matters. And I don't know about you, but if I think about my best and my worst bosses, the ones I liked the most were the ones I felt I could relate to. They remembered my name. They knew what I did at the place. They wanted to come help. They offered advice. They were there for me. So those kinds of things, I think, make this completely true, that healthcare is a relational endeavor, and you can argue with me on that. You could say, no, it's a financial endeavor. We're at HFMA. Tell me about dollars and cents. But it all relates. I want to talk a little bit about my leadership journey, not because I'm conceited. Well, maybe I am a little. But mostly because I really worked my way up through healthcare into the spot I am now. My current role is Vice President and Chief Nursing Officer at Legacy Meridian Park Medical Center here in the Portland metro area. And my very, very first healthcare job was as a hospital volunteer. They called us candy stripers back then, and yes, I did wear a white pinafore with pink stripes on it. And what I learned in that job, because I was terrified of people, I'm an introvert by type, stereotype, real type, whatever. I'm an introvert who can play an extrovert when I need to. But I didn't used to be able to play the extrovert at all. I was so terminally shy. I hated talking to people, particularly strangers. And my mom said, you really need to do some volunteer work. It would look good on your college application. And I was like, oh, man, don't really want to go do people. But my brother had been ill when he was a child, and I was somewhat comfortable with hospitals. I thought the people that worked there were kind of cool. And so I signed up to be a volunteer, and they were like, you can work at this desk and just look up people's names and where they are in the hospital and tell folks where their loved ones are. Cool, I can do that. Very minimal talking, mostly typing on an MS-DOS computer. With a shift F4, that's what's seared in my memory anyway. I'm not going to have to talk to anyone. Well, one day they were short for the bedside volunteers, and they were like, guess what? You get to float away from the desk, because what we really need is someone who will deliver water, blankets, and talk to lonely patients. And I was like, I think I'm getting a fever right now. That sounds really scary. I'm going to have to call my mom. We need to get out of here. So I was really shy, but I forced myself to do it. I said, you know what? I'm going to be brave. I'm going to do this. I was very nervous the entire time. People had gross wounds. I did not know what to do about that. I just was kind of like, here's your water. And ran out. Slowly but surely, though, as I did that role more often, I learned that there were a lot of elderly patients in the hospital who were really lonely. Their families didn't come by, and I got to hear their stories, and they just wanted someone to talk to. And sometimes they thought I was their granddaughter, and sometimes they didn't, but it was a really good experience. I also learned that parents of children sometimes have to work. And there were kids in the hospital who didn't have their parents with them. And that was also very, very lonely. So on some of my shifts, I got to play with children and hear about their stories and what it was like to be sick. And I say all this because my role didn't feel like a human role when I took it. But what that role did for me was it got me over the fear of talking to people, particularly strangers, and particularly sick people, right? And it taught me that doing something new is important. We should never, ever be afraid to try something new, even when it's scary and involves people. Because people can be kind of scary, and I'm betting there's more than one person either watching online or in this room who wouldn't consider themselves necessarily a people person. Like, I'm okay with my spreadsheets and my numbers, and it's all right if I send those via however I do, but I'm okay with not doing the people part. And I'm hoping you'll realize that maybe it's a mix of that by the end of this discussion, that we have something more than just our spreadsheets to keep us company. But don't get me wrong, I love a good spreadsheet with a pivot table if possible. Thank you. So I am working at the volunteer station at this hospital, and there's a coffee cart around the corner that's owned by a couple of the paramedics. And I would go there and get an Italian soda, or sometimes when I was really brave, a coffee, because I was pretty hyper kid anyways. You didn't really need to caffeinate me. But one day, the manager, who was probably a college kid at that time, came up to me and said, "Hey, would you ever want to work at this coffee place?" And then she was like, you'll make money. And I was like, oh yeah, I'm doing this job for free. Money sounds great. I'll make money. So I applied for that job, ended up getting hired. And so that was my first hospital job in food and nutrition. And very public facing, right? Lots of people come up to you. I got to know my regulars. I knew that Sandy from lab, right at 7 a.m. on the dot, wanted a quad shot, and that she'd always tip $1. And you always remember the people who tip. That's another lesson. But lots of busyness, lots of working through, big, huge crises, like you accidentally made that with full fat milk and I wanted non-fat. And is that really half calf? I'm not sure. Lots of people take their coffee very seriously. And it was a great job for me to see all the different roles in the hospital. So I saw everyone. Here's a person who registers patients. Here's somebody who works in revenue cycle. Here's someone who is the CEO of the hospital and they are in charge of everything. And when they came to my coffee shop, I was still the one in control. I had all the power. I could make your day very good or very bad with just the amount of caffeine I was delivering. Not to be on a power trip or anything. But what I did learn about that job is that what I did mattered. What I did mattered to the people who got coffee from me. It mattered to them that I got their coffee right, that I was pleasant and friendly to them in the morning, that it mattered if I showed up on time. If I showed up 30 minutes late and the coffee shop was supposed to be open, people were not pleased. And I will say, I know we're having a snowstorm right now. The last snowstorm, my Starbucks closed, and I was incensed. I was like, I have to go to healthcare. I have to go to work. How can you people get to take the day off? So I know how these people felt if I slept in and didn't show up to my job, right? So what I learned in this job is when you say you'll do something, you do it. You always follow through because it matters. Even if you think your job is small and unimportant, absolutely, when you say you will do something, you do it. And that creates trust with the people around you. It helps people understand that you're a trustworthy person. And whether you want to be a barista for the rest of your life, or you'd someday like to be the CEO of the company, this is something that will stick with you. If you follow through when people ask you to do something, you're known as a trustworthy person. Also, when you say, I can't do that, people tend to trust that too because they know that you're good for your word. Goes a long way. Well, I worked in coffee for a while, and the hours are super early mornings, and I couldn't get afternoon work, and my school schedule was becoming increasingly more difficult to work the coffee job. So I decided I'd apply for an open night shift patient registration clerk job in the ER. And I was a little nervous. I thought the supervisor was a bit intimidating. She was a lot and very serious. And I was like, I don't get the big deal. I'm just like checking people in. It's fine. But it was a big deal, right? It was an important job. And I learned a lot of things about how that job was important in that role. So I got the job, part-time, night shift, ED registrar, and I had to do stuff that I didn't really like. Again, like is that the theme of my thing? No, it's not. But I think there's things about every job that you're like, that's not my favorite. So I was okay like entering people's names and getting them checked in. The part about the job I really didn't like was after they saw the doctor, I was supposed to go ask for a copay. And here I am, 19 years old, going into someone's room and being like, so I hate to tell you this, but you have United. Fill in the blank, right? And that's a hard conversation to have for some adults, much less someone at 19. And I did see some colleagues who cut corners. Definitely saw people who cut corners. So they would do things like, let me look up and see if I can check all the insurances in the entire world and see if they land on one of these plans. Because if they do, maybe I don't have to have that follow-up conversation and actually ask for their insurance card. Or they would enter patient unable or declines to pay today instead of actually asking them if they could make their copay. And they were like, yeah, it's no big deal. They'll just bill them later. It's totally fine. Totally fine. Sometimes they wouldn't care if the insurance was right. So they'd get the insurance card, couple numbers are misplaced on there. What's the problem? It's not a big deal. Nobody will mind. Sometimes they wouldn't ask for an ID, and they would just take whatever the patient said was their name. And as a 19-year-old who doesn't know any better, some of that I was like, oh, that's interesting. That sounds easy. Do I want to do that too? And then I had this like immense guilt, like, well, Sharon, who was my boss, said I have to do it this way. And what if Sharon's watching right now? Sharon could be watching me. Or there could be spies around here, and they're going to tell Sharon that I'm not doing the right thing. And so honestly, truly, rather than doing the right thing there, because I didn't know what the consequences of these things were, Sharon, the boss, was who terrified me into doing the right thing. But after working in the department a while, I learned some things, like if you don't get a patient's ID and they give you a different name, somebody else might end up bankrupt over those bills. They could be devastated in financial debt from healthcare because they used somebody's name. And we actually had someone who used their brother-in-law's name. And months later, this guy calls and complains. And, you know, this was before the Freedom of Information. And so you didn't get your results right away and realize you hadn't been to the hospital. This was months and months and months later, and he was already taken to collections by the time he figured out he didn't have this actual hospital bill. And he ended up filing for bankruptcy. How sad is that? Your life is ruined because somebody else decided to use your name. I also found out how much work on the other end if we didn't collect our copays were. So people are now having to look at that account, validate that a copay wasn't collected, reach out to the patient, try to get them to remit a payment, ending up going sometimes through the collections process. I don't know if any of you have tried to call a patient after they've discharged us, but they don't like to answer their phone. It's like their number's fake, but it's not really because they just are screening their calls. They're like, that's back when you would hit *69, who called me? No. No, I'm not gonna answer. So what I learned was that the patient registration job is super important, and doing it right is super important, and it matters to the patient. And getting someone's name and date of birth right so that it matches their previous chart and everything in that chart that talks about their medical history. If you come in unconscious and I think that you have cancer and I start treating you for cancer, but you've never had cancer in your life, that has real health consequences for people. So what I learned in that job was what you do matters, and what you do when no one is watching matters more. What you do when no one is watching matters more. And I still think that sitting at my desk some days. I'm like, I'm pretty sure there's not a candid camera in this room. But what if someone were watching what I was doing right now? Would I be okay? Would I be okay if there was someone videoing me and this was going to be on Instagram tomorrow? Would that be all right? Would my behavior stand up if my boss could see what I was doing, if my best friend could see what I was doing? And I make it sound like I have this devious mind, But I do sometimes think about, like, how could this be easier? Maybe I'll just, and then I have to remind myself, no, I don't want the results of that, nor do I want anyone to ever doubt my integrity as a human. And so it's very important to me that I pretend like I'm being watched all the time, like it's Christmas and Santa Claus knows what I'm doing. So, next job, my hours in patient registration, night shift, they were okay. I was getting some shifts, but, sometimes I was really sleepy in class and wasn't doing my best work. And so I wanted also for the days that I didn't have class to have a day shift job that I could work in. Enter operating room unit clerk. So somebody who I'd actually met through the coffee cart said, hey, my unit clerk is going out on a leave of absence, and I could use someone to do her job while she's away. I know you have a school break coming up, and during the school year, I could also use some, whenever she calls out sick, I could use someone. And I was like, okay, what does that involve? And she's like, it's no big deal. You'll just be sitting at a desk and, entering some things. And I was like, yeah, that sounds great. That sounds great. So I cross-trained to this unit clerk job, and what my job entailed of was, yes, some patient registration and OR scheduling. I also processed all the specimens going out of the OR, which was fascinating. I made sure instrument trays and preference lists for doctors were all up to date. Those of you in finance know what I mean about preference lists. Back then, though, we didn't be like, nope, you can't have that on your preference list. It was like, a cornucopia of whatever you'd like, and we will get it for you because we have infinite money. I'm sure that wasn't the case, but that's how it felt. The doctors get whatever they want in surgery. And it was mostly a cool job. I learned a lot. I learned which doctors you got to page on their pager at night if they needed to be called in, and which ones you don't ever call their phone at home because you didn't realize it, but they'd already been called into the hospital. Or at least that's what their family thought. You learned which ones you only called on their cell phones. There was all sorts of fun rules that you got to realize. And what I learned in this role is that I couldn't take anything too personally. It wasn't about me. So there were multiple times that, usually not from my mistake, but occasionally I would write something down wrong or charge the wrong order, and one of the surgeons would act like a giant toddler and start throwing a tantrum and throwing things and yelling. And again, I'm maybe 20 at this point. I haven't had a lot of experience with grown-ups yelling at me, especially grown-ups in power. So that was really hard for me. And there was one time where I got teary, and I didn't like that. I felt like that made me too vulnerable. And so then I got really teary because I was mad that I was teary. I don't know if anyone's been through that before, but very upset. I was a whole wreck. And I went to go talk to this charge nurse who had been seasoned. She'd been there 30 years. And she's like, Desi, you got a Q-tip. Quit taking it personally. It isn't about you. You're where they're directing it right now, but it's really not about you. They're having a bad day. Something's going wrong in their day. And if you can learn to think about that it's about their imaginary friend that they're mistaking for you, your life will go a lot better. And I thought, that's really stupid, his imaginary friend. I'm not gonna, that's silly. But the next time somebody threw a tantrum and started yelling at me, I was like, oh, he's not yelling at me, he's yelling at an imaginary friend. And it actually worked for me. It sounds super silly, but displacing the anger from me, who he was looking at, and being like, yeah, there's somebody next to me that this isn't really about, I was actually able to filter what it was that that person was saying and take it back and be like, yeah, it's really not about me. I'll own it if I made a mistake and I'll correct it, but the anger isn't about me, and I don't have to let it ruin my day too. So that was a pretty valuable lesson for me. The next job, because the OR job was temporary, and I was at the point in my school career where I really couldn't work nights much more. It was getting really challenging to work nights all night and then go to school all day and then come back for a night shift. So I took a transport aid and radiology scheduler job. Before images were digital, so part of my job was scheduling people for procedures and making sure they knew what procedure they were having, what prep they needed to get done to have that procedure, what kind of things needed to happen, and hanging up films for the doctors. So also running for things, because I was kind of like the grunt. So there's a day, and Eric and I actually worked at the same hospital. He worked in the ER and I worked in radiology. And they needed a stat chest x-ray. There was a patient who was super sick in the ED, and they needed to get a stat chest x-ray. Right now, all hands on deck. The x-ray tech goes over with their big portable machine, gets the x-ray for the team, and goes, Desi, go develop the film and bring it right back. And I'm like, yes, I have a purpose. So I'm taking this heavy x-ray film all the way back to the x-ray department, and I go in the dark room and I unseal it and I process it. And I'm so proud of my work, and it takes a little minutes to get done, and I whisk it back to the ER, and I hang it up for the ER doctor to look at. And the x-ray tech goes, that was good work, Desi. Nice work. I just want to let you know that there's a faster way to do that. So you can actually make this a much more timely procedure. And I was like, great. There's a faster way to do it. Yes. So he comes out and he takes me back to the department, and outside the dark room is a crank. And he says, if you wheel this crank when you have a stat x-ray, it will come out of the machine faster. It turns the turbines faster, and you will actually have this x-ray out faster. I'm like, that is amazing. Thank you. I can't believe nobody told me this during my orientation. I am so excited to be able to be faster and more efficient and better at patient care. So next day, sometime within the next week, there's another stat x-ray. And I'm like, whew, here we go, my chance. So I go with the tech, we go to the ED, they snap the film, they give me the films, and I go back to the dark room and I prep everything and I put it in the machine and I run out of the dark room and I start cranking. Crank, 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 crank. I'm like on this, you guys. I'm developing new muscles I did not know I had. I was so impressive. And the film came out and I brought it back to the ED and I was like, I am a hero. Felt so good about myself. So this goes on for a while. And one day I'm at it cranking the crank, and a radiologist comes up to me and says, Desi, what's that you're doing? And I said, you know, I'm making the film develop faster so that I can get it back because it's an ED film and they really need it stat. And he's like, that's not attached to anything. There's nothing that does. And I was like, great, I have been hazed. So what I learned from that job was to have a sense of humor. And I did not haze anyone else, but I was able to laugh at myself and be like, gosh, I'm gullible. I didn't know how that worked. That was pretty funny. Good one, guys. But I did have a lot of fun in that department because the people were fun. They did their work, but they also had a lot of fun and a lot of friendships. And they taught me so much about work not having to be such a serious place that you have to have this gravity in your work. What you're doing is so important, and the way you celebrate together, the way you joke in this group, the way you did pranks, harmless ones, made the work environment more fun. And so I have always tried to have a sense of humor, particularly about myself. Sometimes it's self-deprecating, sometimes it's not. And some people have said, well, doesn't that undermine you as a leader? If you're willing to make fun of yourself, if you're willing to allow yourself to be the butt of a joke, does that make you less of a leader? Do you need to have a formal presence around your team and be formal at all times? And I tend to say it's a balance, right? There are times when laughing doesn't go over because that is not the right tenor for the setting. There are times when if you can have a good laugh with your team or find something funny about the situation that they might want to laugh at but think is inappropriate, it makes you relatable. They say, look, oh, she's one of us. Gosh, that's cool. She thought our joke was funny. Oh, all right, maybe she's not so bad. I'm not trying to win a popularity contest, but having a relationship with my team is important to me. And so being able to take those jokes and not take them too seriously and not take myself too seriously is a great lesson to learn and something that I've carried throughout the rest of my career. Part of my job when I mentioned was an X-ray transporter. So I would transport patients to their imaging from inpatient units usually, right? So, your patients in med-surg, and I'd transfer them down for their ultrasound, or I'd transfer them down for their CT. Well, we had an ICU in that hospital, and one of the things that the nurses would complain about all the time was having to be off the floor for a long exam. So if a patient was on a cardiac monitor, they needed a nurse with them to monitor the patient during the examination to make sure nothing was going wrong. And I listened to the nurses complain and complain and complain. And I went to my boss and I said, hey, boss, is there any way that you would be willing to let me learn how to read cardiac rhythms? Like, is that a thing I could do? Because I'm pretty sure if I could read a heart rate rhythm, that I could help these nurses out. So he let me take the class, and I went to the nurse manager of the ICU, and I said, look, I know there are times that a nurse has to be with a patient because they're unstable. But if the patient is stable and they need to be off your unit for an hour or an hour and a half for a procedure, I passed this cardiac rhythm test. I know how to do CPR. Is there any way I could monitor that patient for you while they're off the unit so the nurses wouldn't have to come off the unit and do their thing? And she's like, absolutely, yes, let me validate your competency. We would love to have you do this. So I had made an extra job for myself, essentially, by monitoring patients when they were off the floor, which led me, when a job came open, to being hired as the telemetry tech for the ICU, monitoring all the people's rhythms, and a certified nursing assistant, because by that time I was far enough in my nursing school that I could do the CNA job. So pretty cool. I got myself a new job. All right. So I was a teletech and a CNA. And I learned about ICU medicine and what that environment was like and how intense it is and how much work it is to be in the ICU. I also learned that the hospital I was working for made a lot of decisions that impacted those nurses, teletechs, and CNAs at the bedside. And I got to hear them grumble about it. None of you have heard staff grumble, I know this. But I was sort of a peer/underling, and I'm just listening. What's going on for these people? Oh, we're going to cut some funding, and so you're going to have to do without people delivering food now. So guess what, nurses? Now you get to deliver the food. And the nurses were pretty angry about that. They didn't understand where that came from. They were like, oh, those people in finance are always making decisions for us. They don't know what it's like to be here. They don't care if we care for patients. And I was like, I don't know, that's a little extreme. But What I learned from that experience was if the nurses had had some sort of say, they still might not liked the end, right? They still may have had the same exact outcome, but they wanted to be talked to about the options. They wanted to be at some table where someone said, hey, guess what? Finances are tough. We need to cut back somewhere in order to keep our hospital open and functioning. And here's some ideas we have. And probably, I wasn't in the C-suite at that time, I wasn't working in finance, probably what they suggested was the least evil of all the evils, right? There was probably something much worse that could have come their way, but they didn't know that. And so they felt like they had no say in what was happening. And so what I learned from that experience, that I still take with me today, nothing about me without me. And so I say that to say we make a lot of decisions, and sometimes those decisions have to be made fast. Sometimes you literally don't have until tomorrow to wait. I think that we overestimate the number of those situations we have in our hospitals. I think there's a lot of situations that could wait a week or two, and we could talk to people about the why. And we could say, here are the bad options we have. And which of these bad options we think this is going to be the less impactful for you, since we have to make a change, this is what we'd like to do for you. And you could tell the people, we need your input. You may not get to make the final decision, but we need to know how this impacts you. What does this make your daily life look like? And that's all they wanted. And they wanted someone to come around and listen to the feedback they had after the thing was implemented. Like, hey, this is really tough. I'm having to do a lot more for my patient. And they just wanted someone to say, gosh, you know what? I know this is really tough. We hope to take other things off your plate. Let's get together and talk about what else could maybe be changed in your workflow. We don't always have that luxury, but when we do, it matters a lot to people that they have a say in the work that happens. It could be anything from a big financial decision to we just want to change your workflow. We want, instead of ABC, we'd like to go CAB now. Tell us more about that. How does that impact you? We're going to start measuring for social determinants of health. We want you to ask the questions. Tell us about that. How comfortable are you asking those questions? Can we give you tools and tips to help? Or are we just going to say, you know what, tomorrow you will now start asking people what their race is and whether they have food insecurity. Doesn't that sound like a great conversation, right? Impact. Thinking about nothing about me without me. We finally graduated nursing school. And it felt like it took forever. And the ICU that I was working in didn't hire new grads. So I decided to go to an ICU in a bigger city and with really sick patients. So I got to be in the midst of some really, really ill people, and for me, that was very rewarding because I like to be precise. I like things to be exact. And in the ICU, they want you to measure stuff. They want the medicine to be the exact dose. They don't want someone to get about this much morphine. They want them to get exactly 0.0 blah, blah, blah morphine per kilogram of weight, right? So I was doing tons of math. I didn't have ChatGPT to tell me what the math should have been. I had to look up stuff in a book and read it. My pumps didn't calculate drip rates for me. I had to calculate my own drip rate. And I loved it. I loved doing the math. I loved being exact. I loved taking care of very sick people. And again, I do like people. I'm getting used to them now, but I still didn't love people. So I sometimes also really liked that most of my patients couldn't speak. Just guilty thing. I was like, it's not so bad that you're sedated right now. It's okay with me. I can take really good care of you. You also can tell them anything. I did find out the hard way, though. I had a colleague whose patient was dying. He was in a coma, intubated for several months, and the family was gathered around like, hey, he could go any day. And they started arguing about Dad's money. Right at the bedside, Dad's in a coma. And they started saying, yeah, I think I should have the house in Sun Valley. We lived in Idaho, so there was this fancy, bougie place called Sun Valley. People would go on vacation. And I want Dad's house in Sun Valley. No, I should get the house in Sun Valley because he took me there more often. Well, I've been caring for him while you guys have been out of state. I should get it. So these kids are like shamelessly arguing at Dad's bedside for several days. Dad wakes up from the coma, tells his nurse, my friend, I'd like to talk to my lawyer. Completely clear-headed, been in a coma for months, talks to his lawyer, makes some changes to his will, dies 2 days later. And he had written all of those ungrateful children out of his will and donated all of his money and assets to a charity. So that was another lesson I learned. People can hear when they're in comas. Just so you know, whatever you're saying to your mom on her deathbed, she might be hearing you. So just keeping that in mind. But another lesson I learned was to always admit when you have a mistake. And I want to tell you about a really big mistake I made. I had a very, very sick patient. He had gotten bit by ticks and had a very, very rare disease from tick bites. And it took us a really long time, actually, to figure out what he had because his symptoms were so strange, and it's such a rare disease. And the man ended up becoming very ill and septic. He was a hiker, which is how he got ticks. He ended up losing all of his toes in the process of this illness. And his lungs collapsed, and so he had a chest tube. He was not breathing on his own. He was a very sick man with lots of drips. And I am, at this point, a fairly experienced ICU nurse, enough so that they'll let me be the charge nurse sometimes. I'm pretty capable. And I call the doctor, and I'm like, I do not know what is going on with this guy. He is not doing well. He's not breathing well. I'm scared he's deteriorating, and I've done everything I can think of, and he is still getting sicker. And the doctor says, okay, Desi, let me come to the bedside. Let's look at this patient together. And so we both look at the patient, and I said, I'm really worried. I can't hear his lungs on one side. I'm really worried his chest tube isn't working. We both look at the chest tube. We're looking at other things on him. We get an x-ray, and he's like, you're right, his lung is collapsed. And I was like, oh, shoot. We got to do something. The guy's still deteriorating. We're like prepping for something. And I happened to roll the guy just a little bit, and I noticed the tiniest little kink in his tubing, like centimeters of a kink in his tubing. And I had told this physician that I had looked at every inch of that tubing. Of course I did. I looked at every inch, and I looked at every visible inch. I just didn't pull it up and look under him that he might be pinching something. And I had to make an apology. Like, we were about to do some surgery or something big on this guy because I didn't notice there was some tubing that was clamped. And I came up to him and I said, Doc, you know what? I am so sorry. Next time I will check the tubing from the patient all the way to the end. And he was like, you know what? You're right. That was a mistake. You shouldn't have done that. And because you admitted your mistake, I trust you all the more. I know that you're going to tell me the truth no matter what's happening, and I know that I can trust you to take care of my patients, and you can take care of my patients any day, which from this guy was actually like a huge compliment. I'd never seen him compliment anyone before. I was like, that's interesting. I get a compliment. But it was true. He was like, not so many people in healthcare in particular have egos. And we do that because we're great at our field, right? We're all experts. We have tons and tons of education. But when you can admit that you made an honest mistake, people respect you for it. People really do. And that still works for me. Every time I'm like, you know what? You're right. I messed up those numbers. That was not the report I wanted to turn in. Let me get it right this time. And people care that you're honest and that you care about your patients. And even if you don't work directly with patients, that you care about what could happen to patients and the downstream effect. And that you're willing to be humble enough to admit, hey, guess what? I made a mistake. And it's okay to make a mistake. So this is how you create trust, right? Being competent at your job, doing the right thing even when no one's looking, admitting when you make a mistake, and being relatable to people. All of that sounds like pretty much relational leading to me, right? Okay, so at the time I was this ICU nurse, I was driving an hour and a half to work and an hour and a half back. How many people have done that, the long commute? Yeah. Again, before Audible, so I had CDs from my library with books on tape. I studied for a certification course, which was super riveting. Listened to FM radio, very exciting. There's only so much you can handle of that for a long time, and I had a toddler at home. So I was also not loving that I left way before she woke up and got home way after she went to bed because of my hours. And I was feeling pretty disconnected and unsatisfied with my work life. And one day, as I'm driving into this great job, I'm like, I just passed 5 hospitals on my way to this great job. Do I really want to work this place for the rest of my career? And I decided no, I wanted to work closer to home. So I found a hospital that was 20 minutes from my house and went to the ICU there. And because I was an ICU nurse, that was my role, that was what I knew. And it was a community hospital, and they did great work for their community. But you remember I said I like to measure things, and I like to be exactly precise, and I like high stakes. And this ICU did not have that. If you had any of those things, you went an hour and a half away to the big hospital. So my patients, while I enjoyed taking care of them, my brain was very bored. I was like, oh, there's nothing for me to do here that's really interesting. So one day they said, we need someone to float to the ER. And I was like, ER sounds interesting, let me go there. And that's where the sick people were. All the sick people were in the ER. So I floated to the ER. Eventually they were like, hey, do you want to take a permanent job here in the ER? And I was like, yes, please, that's where the sick people are. So I took a job as an emergency room nurse. And my whole life changed because that is utter chaos. You talk about knowing what's going to happen. I don't know what's wrong with you. You come in with a complaint, and I have to think about, even as a nurse, I'm not a physician, I'm not diagnosing you, but as a nurse, in order to know what you need, I need to be thinking about the 10 things that could go wrong, the worst case scenarios. What could be the disaster that you're having today? You say you're having belly pain and you think you might be pregnant. I'm thinking you could have a ruptured aorta. You could have an ectopic pregnancy. You could need emergent surgery. Maybe your heart's in your belly and I need to do that. I don't know. But I'm thinking about all the worst case scenarios. And not every patient can be seen at once, right? You all have been to an ER, I'm sure, and have had to wait in the queue and have felt silly because you're like, I am here dying, and you are I'm still sitting in the lobby. But what I learned from that is triage, right? Trying to figure out what is the most important patient right now, who is the highest risk, who could potentially decline the fastest, who could likely die in this waiting room before I can get them back to see a doctor. And that was literally my job day after day, was to decide who's sickest, who needs to come back, how fast can I get them back, and what interventions can I start even before a doctor sees them. This is one of the key leadership traits that I have kept with me my entire career. Triage is essential to survival. I can't do all the things at once as a leader. right? I will always have more on my to-do list than I could possibly do in the next 10 years. And there's always going to be something that's most important. And you'll see super stressed out leaders that are like, okay, Desi, so I'm trying to do this and I'm trying to do that, and I really need to get this done and that done. And I was like, do you? Do all those things need to be done today? What's the most important thing that you get done today? Can you name me the top 3? That if you don't get it done today, something bad's going to happen. And by bad, I don't mean like I'm going to send you an email saying, where was that last eval, right? Bad meaning the hospital's going to shut down. Bad meaning you're going to lose an employee. Bad meaning a patient's going to die. And so I ask my team always to be triaging. Highlight the top 3 things you want to get done today. You could still have that list and you can spend tons of time reorganizing it if you want. But the most important thing is, what do I need for the survival of my business as the CFO of this company and this department? What do I need to be in there? And so this has been a really important skill for me and for my leaders. And this is typically a measure that I do before promoting people. So if I'm thinking about somebody for the next leadership role, I look at how can they triage? How can they decide what's a fire and what's not a fire? Because if everything's a fire, nothing's a fire. And I say that all the time with our quality metrics. If we have 20 quality metrics, we have no quality metrics, friends. You cannot have too many priorities and say that you have a priority. So you have to narrow it down to what can we tackle, what are the top things that really matter to our business, and that's important. So I guess they thought I was doing a good job, so they said, hey, do you want to be the nurse educator? Would you like to educate other nurses? And I was like, sure, that sounds good. A couple days away from the bedside, less peopling, more books. That sounds good. Yeah, let's do it. Let's do it. So I became a nurse educator, and a lot of my job was looking at reference books and making recommendations on what was the current evidence to provide patient care. And this is when I started becoming involved in professional organizations like HFMA, like the Critical Care Nurses Association, like the American College of Healthcare Executives. Organizations that will eventually help my career, even if they don't in the moment. Because the people you meet in these organizations can advance your career. One day you'll meet someone at one of these things who says, you know what, I met you 5 years ago at that Oregon Winter Conference, and I remember you saying that you wanted to be a CEO one day, and I remember being really impressed with you. And just let you know, I'm going to have an opening coming up. I have a critical care nurse opening right now. I am reaching out to people that I met at conferences, that I have met through email from some presentation, and I'm like, hey, I remember you said that you were really interested in this. Guess what? I have an opening, and I'd love to have you on my team, or at least have you apply and see what it's like. So the value of these sorts of relationships and having these connections and peopling on your breaks and like actually talking to people and introducing yourself to people you don't know, so valuable. I cannot tell you how important that's been to my career. People have tapped me on the shoulder because they recognized me from one of these things. So just keep that in mind. The other thing I learned as a nurse educator is that teaching keeps you learning and makes you better. So you don't have to be an educator, but if I read about something and I know it well enough that I could teach another human, even if that's a human in my department, if that's a peer, if that's my dog. Oh no, she's not a human, but she listens and she'll let me teach her. It actually makes me better, because if I know the topic well enough that I can teach somebody, I actually know the topic. And this is how I learned healthcare finance. So I decided that as I got into supervisor and management roles, that I knew a lot about being a nurse. I knew a lot about being in patient registration. I knew a lot about being an X-ray and an OR clerk and making coffee. But I couldn't talk to the finance people. They would be saying, like, this is the NOI of the ROI of the RFP, and I'd be like, could you please speak English? And I realized that I had to meet them halfway. That was part of my job as being a competent leader, was meeting other people halfway. So in order to be a competent leader, I needed to learn finance. So I went back to school, got my MBA, and was like, I'm gonna learn how to lead and understand a balance sheet. I'm gonna understand why things are on the ledger in an accounting sheet like they are. I'm gonna understand how a hospital makes money. I'm gonna understand how we're reimbursed. I'm gonna know how much my hospital has in private or commercial. And you should have seen me as a supervisor emailing the CEO being like, so what percentage of Medicare do we have this month versus commercial pay? And he's like, oh, yeah, I can tell you that, but like, why do you care? But I cared because I am the CFO of my area, right? I am the manager of the ED, and it matters that I know how much of the ED is self-pay. It matters that I know how often we're actually sending a bill for care and whether that bill is accurate. So I said, as a healthcare leader, I have to meet my financial people halfway, but I also asked that my financial people meet me halfway. The best CFO I have ever had in my entire life came while I was the nurse manager of the ED and toured the ED. Is she an expert on healthcare? No. Is she scared of people? 100%. But she said, I want to know when you're asking for staffing what you're really talking about. And I want to know when you're talking levels 1 through 5 in ED billing that I know what that looks like. What's a level 1 patient? What's a level 5 patient? When we talk about left without being seen and lost opportunity to bill in the hospital, why are people leaving? She didn't go there because she liked blood and guts. She wanted to meet me halfway and relate to me so that when I brought stuff to the table, she wasn't completely ignorant. And I still respect her more than any CFO I have ever met in my entire life. And I will always respect someone who steps out of their comfort zone and comes and meets me in my area and tries to understand me, because guess what? Even if I don't understand where you're coming from, that makes me want to understand you more. I want to know then, where are we financially and why are we making the decisions? Because you invested in caring about where I'm coming from and didn't look at me with this blank look at the table and be like, well, that doesn't make any sense. Because it's easy to do, right? It's easy to be like, that's your business. I demand that you describe it to me in a way that I understand. And yes, we should be able to do that, but we should also have the empathy to make the relationship, at least with that frontline leader, to say, I see you, I see the work you're doing, and it makes sense to me. The other thing I learned as a supervisor and manager is about how important it is to create a culture. And we may think that culture is just, it's the people who show up, it's our organizational values. Yeah, those things matter. But if you think about who makes your culture and who makes people want to come to work or not, I bet all of you have had a bad boss before. And I bet you didn't want to come to work very much that day. I've had a bad boss. And I hated coming to work, and I loved my coworkers. They were great. I loved the organization. It was great. I believed in our values and our mission and vision, but my boss was awful. I did not want to come to work, and even though I said I wanted to do my best job, I probably didn't do my best job because I was spending half my time ruminating on what she was. And so it starts with you, right? As a leader. It's not all about you as the leader, but it does start with you. You set the example. You decide what's acceptable in your culture and what isn't. You decide if it's okay to bully people. You decide if it's okay to get your work done. You decide if it's okay to show up 2 hours late to work. You decide if it's okay to, beyond your Oregon FMLA, to miss an abundance of work. You get to decide what happens in that unit, and you get to decide the culture. And every single one of those people is watching you to see what you'll do. Not that you have to tell them what you do, but if Jane shows up every day 2 hours late and then spends an hour putting on her makeup in the morning, and nothing happens for months and months and months and nothing changes, I'm just going to make an assumption that that's okay. And you know what? I don't like doing my makeup before I come to work. Maybe I should come later and set up a mirror by the pharmacy station and do my makeup. Literally had an employee doing that. But you promote what you permit. So whatever you permit in your environment, whatever people get away with, is the culture you're creating. And that sounds pretty harsh, but I actually think it goes both ways, right? If I permit and I promote a culture where people are recognized when they do hard work, where they are thanked for going above and beyond, where I see them and acknowledge them, that's the culture I create. If I create a culture where everyone is expected to show up on time and do their work, if I create a culture where you're not allowed to bully people because you don't like what they're doing, then people notice. And that's the culture we maintain. And your frontline leaders make a difference too. So if you have supervisors, if in my case I had a charge nurse, they're also parroting that and creating that overall culture, and that's important. Okay, so then I got to be a director. My director was leaving for a promotion, and I said, I'd like to be a director someday. I'd told her that in our one-on-ones. I'd like to be a director someday. And so this position opened, and there were a few applicants, and I wasn't sure I'd get it. And I was pretty nervous because it's one thing to have one department, and now you're going to say I'm going to have 5. And instead of 120 direct reports, I'm going to have close to 500. That's a lot of responsibility. It made me pretty nervous. I did end up getting the job, and I worked over multiple emergency departments, and that's actually where I was during the pandemic, running emergency departments. And what I learned through the pandemic, and I think I would have learned it anyway, but maybe a little bit slower, was how traumatic caring for very sick people when you're also worried about your own health is. And I had nurses sleeping in their cars because they didn't want to bring home illnesses to their family. I know you've heard these stories, but it was really personal for me that I had people acting like they were homeless because they didn't want to take things home to their family. One of the physicians I worked with got buck naked in her garage before she got in the house because she didn't want her clothes to touch anyone. I had people buying their own extra PPE on Amazon, which was like, I was like, you guys, we don't even know if it works. It hasn't been vetted. But people were scared, right? And when you come to work with your own emotional trauma and then you try to take care of another human, and what these humans were doing was saying, I'm in crisis, but I'm going to set my crisis aside and care for you. And what do you think happens when you set your crisis aside for other people and you care for others? It just builds and builds and builds and becomes toxic, and people burn out, and people get frustrated and angry. I'm at a different hospital now, but I still have people who are angry about what happened to them during COVID and the feelings they have, and they still haven't dealt with it. And what I learned in that situation that I still take with me as a vice president today is that caring for the people who care for the people is the best part about leading. And I would venture to say the most important part. Because yes, getting in my metrics is great. having great patient outcomes, having happy patients. All that is awesome. It's so awesome. And caring for the people who are doing the work. If I don't care for them, they're not going to take good care of the patients. They can't come to work in crisis and honestly do their best job. It's just not possible. So what I have to do is make sure that they have the things to survive and thrive. I have to make sure they have basic needs, right? Access to water, access to a toilet, access to support and time off and breaks when they need them, access to healthy food. All those small things, but I also just have to be someone to listen, and I have to understand where they're coming from. I had someone during the pandemic who was a senior leader I worked with, and no fault of their own, they just didn't relate to the people. And they were trying to force out a new kind of PPE for people to wear. And the staff at the bedside were like, no, this doesn't work, we don't want it, we're not gonna wear your PPE. And, you know, the leader thought they were being obstinate. They were like, these people are just being difficult, they just need to do what they're told, and we need to move along. And so what I did was I went out with the staff on the unit to the bedside and said, tell me about your PPE. Let's have a fashion show. Why don't you put it on and take it off and tell me what's wrong with it? And so they did. They put them on for me, and they had me put it on, and they're like, okay, Desi, try to get out of that without tearing it in half. And I was like, oh, challenge accepted. I could do this. No, I couldn't. The PPE was crap. They were putting it on, and by the time they got in the room, it was ripped. Okay, so I'm supposed to wear this to protect me, and it's ripped between the hallway and the room because it doesn't accommodate any shoulder movement. My shoulders might be broad, but they're not that broad. So I had people, we brought in new vendors, and I had people of all different sizes from the floor come try on the new PPE and take it off and give us a rating. And guess what? After that, we had no PPE complaints because people knew, we knew what the problems were. They knew they could be safe at work. And all it took was me going to the bedside and understanding where the people were coming from. And it's super tempting to stay in our offices and make really great decisions for other people. But the most important thing you can do is go see the people in their moment and actually see their problem. I mean, there's just things emails don't describe. So caring for the people who care for the people is the best part about leading. I then became the senior director for 21 clinics, multiple sub-direct reports. And this is where I learned a saying that you've heard before if you've studied any sort of literature from leadership: culture eats strategy for breakfast. It's a quote by Peter Drucker. And I had folks in some of my areas that had done things the way they did them for a very long time. And often what I heard was, we've always done it this way. And I'd be like, but what if we do it this new way? It'd be real fun. And they're like, no, I don't really want to. I like the way we do it, and that works. Or, you know what, we tried that once in 1998, and it didn't work. So we're not gonna try it again. Any excuse you could think of. I don't have the time to try something new, don't want to. And I had this organization being like, guess what, guys, we have strategic goals we gotta meet, and I knew we weren't gonna meet them doing the same thing we'd been doing. Like, it's not working. It also hasn't worked what you've been doing since 1998, or maybe before. So we gotta try something new. And so what I realized was that was the culture. We don't try things new, we do things the way we want to, and that's when I also realized relationships eat strategy for breakfast. So it wasn't really the culture, it was the trust they had in me that what we could do could work. And so that's, again, I had to involve the people on the front line, right? Nothing with me without me, to help me say, okay, friends, we don't get a choice on what we're doing. We are going to meet some financial targets this year, and I know you're excited, but guess what? I'm gonna let you decide how we're gonna meet them. And we're going to do something different. And I want you to commit to one thing you can do different. And then once they saw that one thing worked, they were like, oh, I was like, what do you think about a second? Do you think we could do a second? Anybody? Anybody? We did it. We completely changed the culture. We met our financial targets, and we did really well. But it took a lot of work, and it took a lot of peopling and relationships. And people had to know, like, hey, I have some legitimacy. I've done this before. The finance people know I can speak their language. It will work. And we had to have some trust. So now here I am, Vice President, Chief Nursing Officer at this hospital. And I've taken every single one of those lessons that I've learned with me and kind of scooped them into my toolkit that I use on a daily basis to try to be effective. And the way I measure my impact on whether I am being a good leader, whether what I'm doing is working and meeting the needs of the people around me, is by understanding that my impact as a leader is measured in how people feel about me. And don't get me wrong, there are some people who are haters. I have a terrorist club that are probably out there setting a bomb on my car right now. It's fine. It's totally fine. I've been watching spy shows lately, so I feel pretty prepared. But overall, how's the feeling? Like when people talk about you, do they say positive things? Do they say, she understands me? I don't like that decision she made, but she helped me understand the why. I always know that I can tell her anything. I can approach her. She's approachable, she's kind, she helps me out. So what do? I believe that relationship is a relational endeavor, and I go out on the floors. Yesterday, I spent my entire day in endoscopy shadowing surgeons and techs in their environment doing colonoscopies. So that was my day yesterday. Very fascinating. But it's all aspects of that, right? So I'm talking to them about how's your healthcare environment? How are these surgeons to work with? How many cases are we doing today? How much do we make off of a case? Could we fit more cases in a day? Is that doable? I don't know. Let's look. I'm looking at all of these things and asking people, what gets in your way? Tell me what your biggest pain points are today. What's getting in your way of doing the good job that you want to do? And there's always something that's getting in someone's way that's a bureaucracy or something that I can help change. My ability to communicate, to create change, to meet strategic and financial goals, and to advance in this career is all based on understanding others. If I understand where you're coming from, and that includes my peers, folks, right? I need to understand where the other people in the organization are coming from, too. I need to know why my chief financial officer wants what he wants. I need to know why revenue cycle wants what they want. I need to know what's motivating people so that I can meet them at least halfway, if not all the way. The most impactful financial leader is the one who can help understand what's going on at the front line enough that they can talk intelligently and understand what leaders are trying to translate. And the best operational leader will be able to do the same thing in finance. Because people respect you more when they know you understand. And this is actually me in a room in COVID with my team. If they know what you're going through, if they know what you've been through, if they're willing to know that you would go all the way if you had to, that makes a difference. One of the leaders that I worked with during COVID went home and went home for the entire time. And I'm not saying that was the right or wrong thing to do, but people noticed. And that was an operational leader who had staff who were working on the front line. And it mattered to them that they saw certain other leaders there and they didn't see theirs. So it matters that people know what you want to do, what you can do. And then talk to people about their work. I love rounding. I love asking questions. I have spent 8 to 12 hours in every single one of our nursing units. I have spent 8 hours with respiratory therapy. I go out and round with patient access regularly. I go and round on the doctors regularly. I go in the OR and I watch cases and I ask questions and I get to know the people in facilities and what they do and how they make our operations run and what kind of capital assets they think they're going to need to keep our facility operational next year. I do all of this without sending an email. I go talk to people and I make relationships. And I make sure to show authenticity and gratitude. So this is a few of the awards we have at our hospital, but I make sure that people get rewarded for the work they do and that they're recognized for working hard. And above all, I try to lead by example. Again, what I do when no one's watching, except Santa Claus, makes a difference in how I lead as a leader. And then one other thing I think is just a great leadership trait that will take you far if you want to advance your career is being active in your community. I've also gotten very great references and referrals for leadership opportunities by just volunteering and people seeing that I volunteer. Volunteering at the food bank, this is me and my team cooking from a couple years ago, cooking dinner at the Ronald McDonald House for the kids and families who didn't have money or a place to stay. So making sure that I am keeping active in my community and being visible, because that matters too. Giving back matters. And also, did you know that giving back gives you more joy than getting a present? It's statistically proven for those of you who like numbers. And then have fun with people and be relatable. This is a silly picture. This is me being silly. This is me cuddling an otter at an employee event because they asked me to. And then never pass up the opportunity to learn. I do have a couple of book recommendations for you if you're Audible lovers or if you're leadership book readers. Human-Centered Leadership, and that's me with the authors. It is Human-Centered Leadership in Healthcare, and they talk all about how to be a human-centered leader and how to further yourself and have the enough emotional intelligence to relate to those folks in different areas than you. The next one is Patrick Lencioni's The 5 Dysfunctions of a Team. This is a super fun book. It's written from the perspective of like a fake company, but the principles in it are exactly how you create a trusting team and how teams fail when you don't create a trusting team. And this is one of my favorites also, Admiral William McRaven's Make Your Bed. This is like basic leadership functions. And sometimes you guys, I've been in leadership for quite a while. I sometimes pick this up and reread it. It's just got some really core good lessons that I'd like to be fundamental in the way I lead. And I had this stereotype that military leaders were kind of cold and hierarchical and off-putting. That is not this at all. This is about how you be a personal and relational leader. And then if you have a new leader in your area, I always buy them this book, Monday Morning Leadership. It's just the basics on how to be a trustable, reliable leader and how to create a good culture in your units. And that was so many words. Thank you so much for your time. And does anyone have questions? Hi. They might want you to come up to the mic. I'm sorry. Because of our Zoom friends. I know. It just makes you, but the spotlight is good for you. It is.
Thanks.
It's really good.
Sorry. I just wanted to say thank you for sharing today. It was amazing.
Oh, thanks.
Your story is incredible, and I'd love to get a copy of it. I mean, do you have a recording of this?
Oh, I haven't yet, but I could record myself.
I would love that if I could
Yeah.
get a recording, because everything you share, the examples, it's a beautiful story.
Thank
and,
you.
Obviously, you've made a huge impact in so many people's lives, so thank you.
Thank you. I appreciate that very much.
I think we're recording the presentation.
Oh. All right, so I can criticize all the ums, ands, and I said. during the presentation. Other questions? Nope. I don't know how to see if we have questions online. No questions. Okay. Reach out if you have anything. My email, I think, is in the bio. Just reach out. Happy to have a chat with you. And I really am so grateful for you having me here. Have a fabulous day. This is going to be a great conference. And it's really warm in here, Zoom people. You're missing out. There's great pastries.